So welcome everybody to today's webinar. My name is Layla and I'm the Community Engagement Coordinator for the Canadian Cancer Survivor Network. And we are here for today's webinar, CCSN's Virtual Action Week, highlights from our meetings with Alberta MLAs. We are pleased to welcome our presenters for today's webinar. We're joined by CCSN's Public Policy Analyst, Conrad Eder. Conrad holds a BA in Economics and is an experienced researcher, writer, and educator. He's been working very closely with the data from our COVID-19 and cancer care surveys over the past several months, and he's very excited to be able to share some in-depth analyses from it. We are also very lucky to be joined by Tim Monds. Tim is a lung cancer advocate who was first diagnosed with stage 1 non-small cell lung cancer and later diagnosed with stage 4 lung cancer about 2 years after his initial diagnosis. He is married with 4 children and 2 grandchildren. After over 30 years as an educator and being recognized with the Leadership Award as a Superintendent of the Year in Alberta, Tim has since retired. Currently, he works with various groups, including Lung Cancer Canada and the Lung Health Foundation, to advocate and raise awareness about lung cancer. He is also a board member with Evic Radon out of the University of Calgary and a volunteer with Alberta Cancer and contributes to a research project at the Tom Baker Cancer Centre. Throughout March, CCSN virtually met with MLAs throughout Alberta to discuss our COVID-19 and cancer care disruption survey. Our survey confirmed that measures in place to deal with the COVID-19 pandemic have continued to negatively impact cancer patients and pre-diagnosis patients' ability to access cancer care services. In our meetings, we explored some of the key findings of our survey, shared stories from patients, and discussed the need to ensure that access to cancer care remain a priority during the third wave of COVID-19 and any subsequent pandemics. During this webinar, we'll hear from Tim about some of his experiences, discuss the key findings from our survey, and take a closer look at the Alberta data, and share some of the key takeaways from meetings. At the end of the presentation, our speakers will be able to answer your questions. However, at any time during the webinar, please feel free to type your questions into the questions tab on your control panel. For those of you who have not attended an earlier webinar, this Canadian Cancer Survivor Network is an organization working with cancer patients and survivors to learn about health system complexities, connect with others to plan action, and act to promote best care and healthier survivorship. If you'd like to learn more about CCSN, please visit our website at survivornet.ca. This webinar is being recorded and it will be available tomorrow on YouTube. In addition, the slides will be available on SlideShare. Links to both will be sent to the email you provided. I'll now turn things over to our presenters.
Thanks so much, Layla, and thank you all very much for taking the time to join us today. I'm incredibly excited to be able to tell you more about our Virtual Action Week in Alberta and also get an opportunity to really dig into our Alberta data set from our national COVID-19 and cancer care survey. So I'll go ahead and share my slides. Layla, I will get you to give me the thumbs up that we have those on screen. I think we should be good to go. We're all set? Okay, perfect.
Perfect.
So again, thanks so much for joining us. My name is Conrad Eder. I'm the Public Policy Analyst at the Canadian Cancer Survivor Network, and I'm so overjoyed to be joined by Tim Monds, who is an integral part of our CCSN Virtual Action Week in Alberta. Today's meeting is going to be broken down into 2 major categories. With a Q&A to wrap up. I'm very happy to take your questions, and I'm sure that Tim feels the same. We'll start off by speaking about our Alberta Virtual Action Week. We'll go over our meetings, our conversations, some of the major takeaways and major themes, and I also want to discuss some recent developments, particularly in terms of the COVID-19 vaccine and how that is being rolled out in Alberta. Finally, as I mentioned, we're really happy that Tim has taken the time to join us. He was one of 2 patient advocates who joined us during the course of our Virtual Action Week, and we wanted to acknowledge both of them, and we're very glad that Tim has taken the time to speak with us all again today. For the second half of the presentation, I'm going to get a chance to dig into some of the data from our cancer care survey and focus on Alberta. Really try to get a better sense of how patients, caregivers, and pre-diagnosis patients in Alberta have been impacted by the COVID-19 pandemic, and some comparisons between other regions in Canada and our greater data set. Like I said, we'll wrap up with a Q&A, so any questions that you have, just make a quick note or go ahead and throw that in the chat. Like Layla mentioned, really happy to dig into those questions at the end. All right, so let's get started with our Alberta Virtual Action Week. As has become a theme for the Virtual Action Weeks that I've been a part of, they quickly end up being more like virtual advocacy months. We might need to consider a name change because our Virtual Action Week took place from March 8th to April 8th. It just wrapped up a little while ago. And our virtual action week was an opportunity for us to sit down and meet with elected officials as well as other decision makers in Alberta and focus on amplifying our message. First and foremost, our message that cancer can't wait. But it was also an opportunity to build relationships. This was my first opportunity to meet with MLAs in Alberta, though CCSN has been in touch with representatives in Alberta for some time. So it was a terrific opportunity to begin to build relationships, to continue to form connections, and as I mentioned, amplify our message. Our meeting is primarily focused on our cancer care survey, but also particularly on COVID-19 vaccination. We know that that's an issue that's been a particular top of mind across Canada, but especially in Alberta over the last few months. So we wanted to emphasize the concerns of patients, caregivers, and pre-diagnosis patients in the province. Here's a quick rundown of the various meetings that we had over the course of our month. I should point out that it included representatives on both sides of the aisle, and we were very happy to speak to MLAs both in government and in opposition. It also included several meetings that I had with Alberta Health Services when we speak about those decision makers within the mechanisms of government. I've now had the chance to speak with Alberta Health Services 3 times, on each occasion diving into a slightly different topic within our COVID-19 and cancer care survey. And I'm looking forward to a 4th meeting just coming up at the beginning of next month. So we know that these conversations need to continue. And one of the ways that we're doing that is engaging heavily with the Alberta Health Services and making sure that we're able to share as much of our data, but also look for opportunities in the future to partner to bolster our data sets and be able to bring more intelligence to government and to decision makers to better base the decisions they're making in terms of cancer care in the province. I want to briefly speak about some of our objectives and I guess sort of an overview of our action week and the problem, solution, and action that was the primary focus of probably the first half of our meetings. First and foremost, the problem remains clear both in Alberta and in many places across the country based on our COVID-19 and cancer care survey, and that is the fact that cancer patients, their caregivers, and pre-diagnosis patients across the country remain in doubt about accessing healthcare services, and we know that this can lead to worse outcomes, not just physical health outcomes, as was unveiled in our survey, but our survey also focused on some of the mental health implications of having appointments and procedures delayed, canceled, and postponed. So for the first half of our meetings, we wanted to provide the province of Alberta with a specific solution. And one of the areas that we thought needed to be addressed, again, this is back to early March, we needed the Alberta government to step up, like many other provinces in Canada had already at the time, and prioritize cancer patients for the phase 2 Group B priority for the COVID-19 vaccine. In Alberta, thinking back to the beginning of March, there were several other provinces that had already come out with lists specifically citing cancer patients as being prioritized for the COVID-19 vaccine. Some of the first included British Columbia and Saskatchewan. Ontario followed suit, but Alberta was one province that was lagging behind, and we wanted to particularly emphasize this to both MLAs in government and opposition. Clearly, our action was very straightforward. We needed the health minister to be aware of the implications that the COVID-19 pandemic has had on cancer patients across Alberta, and to emphasize the importance of prioritizing cancer patients for the vaccine. Now, fortunately, this is something that was adopted. It did go through in the midst of our Alberta virtual month. And we're very pleased that we were one of, I should say, many, many, many voices, both patient advocacy groups, patients, and professional organizations that were all calling for this prioritization. This was very much a step in the right direction, but it brought out sort of a next step, a follow-up that was very important that the Alberta government needed to be aware of. And that is the fact that across Canada, in many provinces, cancer patients are receiving the 2nd dose of their COVID-19 vaccine, sometimes months after their first. And it was brought to our attention over the course of our meetings in Alberta of particular emerging evidence out of the United Kingdom that spoke to the fact that cancer patients were not receiving the same kind of protection. They weren't generating the same immune response from one dose of the COVID-19 vaccine that the general population was. This is something that was very concerning. As we know in Canada, we've been trying to get as many vaccines to as many people in the spirit of equitable protection for all Canadians against the COVID-19 pandemic. But that equity was unfortunately not being achieved when it came to the cancer community, as emerging evidence suggested that cancer patients were being left behind. They were not receiving the same degree of protection. And that's why in the second half of our Alberta Virtual Action Week, we focused on the importance of cancer patients being prioritized for timely access to both the first and second dose of the COVID-19 vaccine. And this specifically meant that we wanted cancer patients to receive the second dose of their vaccine in line with the manufacturer's recommended timeframe, which, depending on which vaccine, was about 3 to 4 weeks after the first dose. Again, our call to action was very similar. It's so important that this kind of information is brought before the health minister and that he's aware of the implications that the first and second dose can have on the cancer community. In sharing a lot of this information with some of the MLAs and staffers that we met with, they weren't actually aware of this emerging evidence at the time. Again, this is about a few weeks ago. And we're very happy that we were able to shed a light on this and bring it to the government's attention. It should be noted that we are by no means the only group or individuals who are calling for the prioritization of cancer patients to receive both the first and the second dose of the COVID-19 vaccine. Looking back even a month ago, this was one of the articles that we highlighted to representatives that we met with that was published in the Globe and Mail. It was an op-ed written by Dr. Isaac Bogosh, who would be familiar to many if you're joining us from Ontario today, as he sits on the task force in that province, and Dr. David Naylor, who again is an expert in Canada, who sits on the national COVID-19 task force. They put together this op-ed specifically calling on governments across Canada to ensure that they take a tailored approach to those who are immunocompromised and recognize the fact that, among other groups, cancer patients require particular attention when it comes to the delivery of the COVID-19 vaccine to, as I mentioned earlier, ensure equitable protection across the population. As of late, this issue continues to feature across a variety of news outlets. I want to feature a couple of articles. First of all, this that appeared in the Calgary Herald just a couple of days ago. As I mentioned, we know that cancer patients, advocacy groups across the country are involved in advocating that cancer patients be prioritized to receive their second dose. And this is one of the articles that emphasizes that. In particular, I should also mention that there are professional organizations across Canada that have made very similar calls. And specifically, the Canadian Association of Pharmacy and Oncology is calling on NACI, depending on how you want to pronounce it, to specifically recommend that cancer patients receive their second dose on the manufacturer's recommended schedule. This is just on the bottom of the slide here. We can see a quote from the president of that organization, which was featured in this CTV news article just published a couple of days ago, making reference to the exact study that I just spoke about, suggesting that it shows that 3 weeks after one dose of the vaccine, an antibody response was only found in 39% of people with solid cancers and just 13% of people with blood cancers. And to put that in context, that same study isolated a separate group of those who did not have a solid or blood cancer and found that those participants had upwards of a 90 to 95% immune response just after the one dose at the 3-week mark. So we know the difference in protection is very significant. And in order to ensure equitable access for all Canadians, it is pivotal that, particularly our conversation today, we prioritize cancer patients, not only for the first dose, which has now generally been done across Canada, but that second dose is so important. And finally, we know that all of you, many of the advocates, patients, caregivers, pre-diagnosis patients who are joining us today for this presentation have already stood up and been counted as far as your concerns for the interval between the first and second dose. I just wanted to pull this screenshot of a petition that has been widely distributed in the patient advocacy organization space. And we can see that just under 25,000 signatures are currently on this. I should actually mention, this screenshot was taken a couple days ago, so by now perhaps we have more than 25,000 signatures on reminding representatives across Canada how important it is that cancer patients be prioritized to receive their second dose within the manufacturer recommended interval. If you haven't already signed this petition, we really want to make sure that you take a look at this by searching or Googling the subject line you can see right there on the slide. You should be able to track it down. We're trying to get this circulated as widely as possible so we can continue to put pressure on our representatives to ensure that this kind of action is taken. Finally, just before I mention our patient advocates who generously gave their time to join us during our Action Week in Alberta, I want to mention this particular quote, which just came out. Today's the 22nd, so just 2 days ago. I want to mention and reinforce the fact that we are making a difference, and we need to continue to apply pressure to our representatives that action is taken. Just a couple of days ago, for the first time in Alberta, Dr. Deena Hinshaw had this to say. She said that we are closely monitoring the emerging evidence around timing of second doses for cancer patients and others with severely immune compromised, and we are consulting with provincial and national partners and will update Albertans if any changes are made for these groups. Now, this is the first time that Dr. Hinshaw has made any reference to prioritizing cancer patients for the second dose of the COVID-19 vaccine, and we very much see this as our efforts making a difference. Of course, there are so many groups and patient advocates out there who are passionately bringing forward their own personal stories, but also the emerging evidence on this issue. We're very proud and very pleased that we've been one of those voices. And you can see here that our efforts are making a difference. And we're going to continue, as I mentioned, our meetings with Alberta Health Services and MLAs across Alberta to drive home our message that cancer can't wait. Now, just before I open up the floor to Tim to make a few comments, I did want to pause, as I paused the last time I spoke about our Virtual Action Week in Ontario, and acknowledge the time and the energy that patient advocates have put in to our Virtual Action Weeks over time. And just to acknowledge the two individuals that joined us during our meetings in Alberta, Tim and Dave, thank you so very much for the contributions, again, of your time, of your energy. I know that it makes such a difference to have a patient advocate join us during our meetings. It makes it so much more real and personal and makes all the difference in the world. So I wanted to, again, pause and acknowledge these two individuals for their great contributions to our Virtual Advocacy Week in Alberta. We really appreciate your time, so thank you so very much. On that topic, we're very, very fortunate to have Tim, one of the two patient advocates who joined us in Alberta, spend a little bit more time with us today and give a characterization of some of the meetings and some of his thoughts and outlook for the province of Alberta. I would really love to hear some of your thoughts. So again, Tim, thanks so much for taking the time to join us once again during today's presentation.
Thanks, Conrad. First, as has been said, I'm a lung cancer patient who's become an advocate, and began with our family doing Give a Breath, raising money for lung cancer in a walk run, but that's evolved into me becoming involved in various organizations. And this particular opportunity with CCSN, and first thanks to Conrad and team for that opportunity to speak on behalf of cancer patients in general, ended up being about the second dose. And so I speak to you as a patient, not a medical person, as a patient who reads, who has been told by my oncologist the concerns he has and the importance of trying to get the dose on time, et cetera, et cetera. So when I had the opportunity to speak to a number of MLAs and staffers with CCSN, I really focused as a patient what it means to me, and I believe other patients, that we'll be at 33% efficacy at 3 weeks with the Pfizer. I'm using only that as an example as a moment, versus maybe 95% is the general population that are healthy. And then at 5 weeks, 43%, whereas it probably could be up to 100% for the healthy, so it says. And so I would say to them, how is that equity? How is that fair? And then I would use what's been said in the articles and so on, one size does not fit all. And I am not trying to be political, but this is going to sound political. There seems like there's a push that we have to have one dose in arms because we don't have enough vaccines. But is that right equitably when we talk about vulnerable population, was my question I'm asking. And we talked about not jumping the queue, that it's just giving us the same efficacy, antibodies, the same opportunities as a healthy person if we get our second dose at the 3 weeks, again, using the Pfizer example. And then I had the opportunity as the door opened with more reports from NACI about jurisdictions being allowed to make decisions about giving the second dose to selected populations, and then how Ontario and Manitoba were making changes, and then asked the question directly. I probably wasn't as wonderfully diplomatic as Conrad was sometimes because I was pretty direct, but why not Alberta? And then it's been said recently that Minister Chandra's office and Premier Kinney cannot ignore the science, but it appears they are picking and choosing what science to focus on. With the data showing 1 in 2 Canadians have or will get cancer, how can this be ignored? We've written letters in Alberta, and many of you have signed them and sent. Some of you have. Emmy, another lung cancer patient in Calgary, wrote some amazing letters. We've sent a letter about the first dose being given at a timely, being included in prioritization, and the second dose at the right time. And we've really not heard much back at all. Just basically received your letter. That's been done federally and provincially. Then also Lung Cancer Canada and Melanoma, all the other various groups have sent major letters to provincial ministers, Mr. Chandro, and to the NACI and so on, and don't know where that's going. Again, one size does not fit all. And as Conrad said on Tuesday, as Albertans, we, at least when I watched, I was pretty excited to hear for the first time Dr. Hinshaw say that they're monitoring basically what's happening with cancer patients. My but to that is research has been out for a while. We hear things yet in Alberta that evolving research has led us to use AstraZeneca at the age limit of 40. Well, what about the evolving research of cancer patients that need that second dose and time to have the same efficacy? So what I've been noticing or feeling like is that there seems to be some response, as Conrad mentioned. We're not hearing anything yet in Alberta, but there feels like there might be. Response from MLAs and staff was very positive during the meetings we were able to be part of. And I'm still hearing from some in particular that there is being brought up daily with Dr. Hinshaw and team, but there's still no answer. So a couple things from my perspective that I was asked to share by Conrad, and I hope this is all great, Conrad. First of all, NACI has to change. That's a big key push for Canada in general, because some provinces are standing behind NACI saying when they change. Well, the door was opened by NACI by saying jurisdiction can do. The MP health critic in Calgary, Michelle Rempel, has been contacted to speak about this. Information has been shared to her. Will she? I don't know. Call her if you know her. Sign the petition has been mentioned with you and your family. Talk to your MLA. I've been doing it. I think he knows me well. We need to be a nuisance. This is one time we have to be a nuisance. We need to be vocal in social media. We need to send letters. We need to have all these wonderful voices from lung cancer to melanoma to the CCSN to support this direction, I believe, for the second dose, which Pfizer itself is not saying anything should go past 3 weeks. So why are we not honoring that research? Then here's going to be my unpolitical or political, I guess anyways. Where is the Canadian Cancer Society in this? Where are they? I haven't heard from them at all. So I guess what I'm trying to say as patients, thank you. As a patient, thank you for everybody out there that we're trying to push this forward. We don't believe it's jumping the queue, but we believe it's talking about equity. Thank you.
Thanks so much, Tim. Again, I really appreciate you taking the time to provide some of your thoughts and feedback. As he mentioned, we'd like to think that there is some progress in the air. There is some progress to be made. And CCSN is very committed to our ongoing conversations in Alberta. In particular, as I mentioned, we'll be sitting down with the Alberta Health Services on a continual basis to bring up these issues. And as more opportunities arise to meet with MLAs across Alberta, we want to maintain, as I said, those relationships, build those connections, and continue to apply pressure on governments across Canada to ensure that cancer patients are being given equitable access to the COVID-19 vaccine and the protection that it confers. At this point in the presentation, we're going to slightly change gears, and I'm going to have an opportunity to present to you in a fairly significant degree of depth our Leger National COVID-19 and Cancer Care Survey. But of course, today, since we're primarily talking about the province of Alberta and the meetings that we've had with MLAs from across the province, that's going to be the focus of my presentation here. I'm going to try and reflect to the best of my ability the experience of cancer patients, their caregivers, and pre-diagnosis patients across the province, and try to build on top of that as much context as we can based on the national averages and the wealth of data that we were able to collect through our survey. So very excited to speak about this to you. This is something that I've been incredibly passionate about over the last several months as we've been focusing on bringing the concerns of the cancer community to the forefront of all the representatives that we've met with. First of all, I want to do a quick overview of our survey, some of the objectives, an array of the questions that we asked, and so forth. And I'll touch on the objectives first. We had three primary goals in conducting our COVID-19 and cancer care survey. First and foremost, we wanted to understand the extent of the disruptions caused by COVID-19 restrictions on cancer care across Canada. And recognizing that those disruptions will have a physical health impact, we also wanted to pay close attention to the mental and emotional toll that those disruptions have had. And I'll be elaborating on that quite a bit during the remainder of today's presentation. Finally, we wanted to identify particular concerns about receiving adequate care over the course of the pandemic, but also moving forward, what are some lingering concerns that exist? Here's a general overview of many of the research topics that we touched on during our survey, and I'm going to do my best to hit each and every one of these with the remaining time that we have today. That includes looking at questions like, have appointments been canceled or rescheduled? Are patients avoiding interaction with the healthcare system? What are the emotional impacts of delays? How are interactions with healthcare teams taking place? We asked many questions about rating quality of care and satisfaction with care received over the pandemic. And finally, as I mentioned earlier, what are some ongoing concerns? What are the primary areas of anxiety? We've now completed 2 COVID-19 and cancer care surveys. If you've happened to catch one of our previous webinars, both the Leger team has presented on this topic, as have I, in the fall, in particular reference to our first wave survey, which was completed last year during the months of May and June. It was a 10-minute online survey, again, conducted nationally. This time around, we just wrapped up our second wave survey at the end of last year in December. The results were unveiled on World Cancer Day in February, and this has been a real cornerstone of our meetings, both in Alberta, but across the country. Our second wave survey was a little bit longer, so we were able to ask a few more questions. I'm going to dive in to some of the insights that we were able to collect. And we also had several more responses. Just over 1,600 patients, caregivers, and pre-diagnosis patients responded to our second survey. I should just pause quickly and just clarify, a cancer patient is anyone who's undergoing treatment for cancer. A caregiver is anyone who's providing support or assistance to a cancer patient. And a pre-diagnosis patient is anyone who's undergoing diagnostic tests to determine if they have cancer. So I'll start off with a national figure. This has been one of the primary statistics that we've shared over the course of our meetings, and has been featured in articles and news releases that CCSN has put out. And then I'm going to dive into some of the regional data in Alberta. So first and foremost, what are the biggest takeaways from our survey? And that is the fact that across Canada, appointments continue to be canceled, postponed, and rescheduled. This is particularly the case for patients and caregivers reporting on the experience of the patient that they care for. Fortunately, we've seen a slight reduction when it comes to pre-diagnosis patients, which, as I'll elaborate a little bit more further on, has a lot to do with a reduction in the hesitancy of pre-diagnosis patients to interact with the healthcare system. But don't let that comment mislead you. Hesitancy when accessing healthcare services is still very much an issue, but we were pleased to see that that has been reduced somewhat in the pre-diagnosis category. All right, so let's jump into the regional data, particularly Alberta. First and foremost, I want to give all the viewers watching today an understanding of what a reschedule or postponed appointment means for a cancer patient or a pre-diagnosis patient in the province of Alberta. And what we found is that it means an average wait to reschedule that appointment of close to 50 days, and for a pre-diagnosis patient is just around a month. Now, when we compare that to the national data, particularly for patients, it's not great. That's a whole another 10 days almost, a bit more than that, actually 11 days, in terms of a longer wait for cancer patients in Alberta to reschedule an appointment than the average across Canada. Pre-diagnosis patients were a little bit closer to the national trend, but still just slightly above. The last point to make on this slide is the fact that 26% of patients in Alberta that we surveyed and 18% of pre-diagnosis patients said that at the time of completing our survey, they did not have a rescheduled date yet. And I don't think I need to tell anyone the mental toll and the emotional toll that that puts on someone to be left in a state of limbo when it comes to being unable to know when your appointment is going to take place. Another area that we specifically looked at in our survey was concerns about receiving adequate care. And I alluded to that just a little bit earlier. Here is a chart that represents the percentage of patients, caregivers, and pre-diagnosis patients who were somewhat or very concerned about their ability to receive adequate care. And we can see over the course of the pandemic, here we can see the height of the first wave, the height of the second wave, and sort of the lulls in between, representing the roller coaster of emotion that's been experienced within the cancer community over the last about a year now, if you can believe it. Now, how does this compare to our national data? Well, we can see that with the national data just brought onto the chart now, it's the faded red, green, and blue corresponding with patient, caregiver, and pre-diagnosis patient. In the case of patients, we can see that the dark red line, which represents Alberta, is just below the national average. So patients in Alberta are slightly less concerned overall than the average Canadian when it comes to receiving adequate care. However, when it comes to caregivers and pre-diagnosis patients, there's a significant increase in their anxiety in the province of Alberta when compared to their other cohorts within other provinces. Next, I want to specifically address those concerns surrounding care. We've had a chance to break them down into three major areas, and these are exactly the kinds of slides I should mention that we're presenting to representatives across Alberta when we sit down and discuss the results of our survey. What we found is that this concern about receiving care seems to manifest itself in three primary areas. The first is concerns when receiving hospital care. The second is concerns for the ability to be cared for in an emergency room. And finally, the third are concerns about receiving cancer treatment in a timely fashion. What we can see is that across the board, all three cohorts in our survey, patients, caregivers, and pre-diagnosis patients, have all expressed a tremendous amount of concern when it comes to their ability to receive any of these forms of healthcare services. But you'll also notice that these concerns are on the rise. They haven't decreased since doing our first survey. They've actually gone up. And what we've seen for all three cohorts is that between the first wave of the pandemic and the second wave, concerns about accessing care is on the rise. And here's an illustration of that. I've got a few of these charts set up today. I'll walk through them and explain them as best as I can, doing our best to try and visually represent some of the statistics that I'm sharing with you today. And on this first slide, what we can see are the national numbers. So this is looking at the entirety of the survey, and we can see that from the first wave to the second wave, Canadians in general are more concerned about their ability to receive hospital care, emergency room care, and being able to be treated for cancer in a timely fashion. Now I'm going to overlay the Alberta data on top of that. It's going to get a little bit messy for a second, and then I'll clean it back up a little bit to bring in some additional context. So here's the Alberta data layered on top of that. We can see that in particular, there are some heightened concerns when it comes to things like receiving hospital care, but I particularly want to focus, there we are, I want to particularly focus on concerns revolving emergency room care. During the first wave of the pandemic, Alberta cancer patients were actually less concerned than the Canadian average in terms of emergency room care access. But this is very much flipped in our Wave 2 survey data, and that's largely as a result of a significant increase in the concern represented amongst our Alberta patient population when compared to the entire national average. We can see that from the first to the second wave of the pandemic, Alberta cancer patients, there was an increase of 31% in how many reflected being very concerned or somewhat concerned about their ability to access emergency room care. Canadian cancer patients on a whole, as I mentioned, still saw an increase in those concerns, but not to the same extent. Next, let's shift gears slightly and talk a little bit about how interactions with the healthcare system have taken place. And first, I want to focus on, in Alberta, healthcare providers that have been interacted with. Particularly, I've broken it down into specialists and then family doctors. And when we look at patients in particular, the red bars on the more left-hand side of the screen, we can see that there has been an increase in interaction with specialists and family doctors between the first and second wave of the pandemic. Actually, fairly significant when we look at 39% reporting an interaction with a family doctor in the first wave. That's up to 58%, and likewise 36% in the first wave with specialists, now up to 51%. In the case of pre-diagnosis patients, we didn't have as strong trends in the upward direction, but I can say that you'll notice 84% pre-diagnosis patient interaction with family doctors likely stands out. Pre-diagnosis patients across the country have been interacting significantly more with their family doctors than with specialists. And that's the same for Alberta as it is, as I mentioned, for the rest of the country. So here's another illustration of that, again, trying to give us the best illustration of the data aside from just the statistics. I hope this is a great visual for those who prefer it. And here we can see patients' interaction with healthcare providers over the course of the pandemic. And these are the Alberta statistics. So as I mentioned, generally speaking, patients have been interacting more with their family doctor than they have with specialists over the course of the pandemic in Alberta. Now I'm going to layer the Canadian data on top. It'll get messy, and then we'll clean it up again. So there's the Canadian data layered on top. Something you should note is that in the first wave of the pandemic, cancer patients in Canada were not tremendously seeing a significant difference in terms of how often they were interacting with specialists and family doctors. However, it was still specialists leading the way, which is, again, the inverse of what we saw in Alberta. So I will particularly focus on that, which is to say that there's a significant gap between the interactions that Alberta cancer patients are having with specialists versus the average across our survey. As I said, in Alberta, cancer patients are interacting more with family doctors than with specialists. But it's actually the opposite way around if we look at the national data. And we can see a fairly significant 15 percentage point difference between Alberta and the Canadian data set in the second wave of the pandemic. Now, a question that I've been asked quite a bit in presenting these data sets and giving many presentations on the Alberta situation, but also across Canada, is, okay, so appointments are increasing, we're having more interaction with the healthcare system, but how are we interacting with the healthcare system? And on this slide, I represent virtual and in-person appointments. So we can see in the case of Alberta, in-person appointments are still actually outpacing virtual appointments. And in particular, we saw a significant increase in in-person appointments with patients from the first wave of the pandemic. That figure was at 55% reporting an interaction in person with their family doctor. Now to the second wave, that number shot up to 80%, which is quite significant. I also want to touch briefly on some of the satisfaction ratings that were provided by patients in terms of the feedback that we received of these interactions. And I'll just focus on the left side of the slide first, looking at cancer patients. And what we can see is in the bottom left-hand corner, in person, satisfaction rates were given at 95 and 96% in terms of patients saying that all of their concerns were addressed and that they were very or somewhat satisfied with receiving care in that fashion. When we look at virtual, not too far behind, but still receiving slightly lower satisfaction scores from patients. In the case of pre-diagnosis patients, it's a similar story. high satisfaction when it comes to in-person interactions, and virtual interactions slightly lagging behind. Now, in conducting our surveys, we did ask patients both to provide us some written feedback and satisfaction scores based on how they prefer the delivery of their healthcare. And I think I have to emphasize that it was somewhat of a mixed bag. As you can see, in-person interaction does receive a higher satisfaction score than virtual, but virtual care still was identified as having an application. And what I've been maintaining in observing the data, anecdotally speaking, with cancer patients, is that virtual care absolutely has a place within the Canadian healthcare system, but the importance is providing cancer patients, pre-diagnosis patients, and caregivers of patients for that matter, choice, giving them the option to experience that interaction with a healthcare provider in a way that they feel best suits their needs. Once again, I brought up here a visualization of the information on the previous slide, and this is the Canadian national data. What we can see stands out pretty quickly. The blue line, which is in-person interactions, has seen a pretty steady increase from the first wave to the second, whereas telephone consultations more or less has remained flat with a slight decline between the first and second wave. You'll notice at the very bottom of this chart, I've also included two other forms of what falls into the category of virtual consultation, and that is email and virtual video consultation with healthcare teams. What you can see is that across Canada, and in a moment I'll bring up the Alberta data, email and virtual video consultations have not caught up, let's say, as I think has been represented at times. We found in the course of completing our survey, again, all across Canada, that email and video consultations have not seen a significant uptick, and telephone consultations remains the most significant form of virtual interaction with healthcare teams. I will overlay now the Alberta data. And what you can see is, generally speaking, everything pretty much lines up as far as being similar. Email, virtual consult, again, at the bottom, pretty clear, those line up pretty good. The green lines, which are telephone consultations, more or less pretty similar. But I want to focus on those in-person interactions with family doctors, just as an illustration. And what we can see is that in Alberta, patients are interacting in person with their family doctors significantly more than the average Canadian. In fact, 20 percentage points more, that's the gap in the second wave of the pandemic, which is fairly close to the gap in the first. Essentially, we've seen a fairly continuous trend, both in terms of interactions in Canada and in Alberta. But the important takeaway here is that Alberta cancer patients have been interacting more often in person than the average Canadian, and that's reflected with their interactions with specialists, and here we have an example with family doctors. Next, I want to touch on who is actually causing these disruptions within the healthcare system in terms of appointments. Something that I touched on in the beginning of the presentation was the fact that the healthcare system itself, and you'll see the very top row here, is that doctors canceling or postponing in-person appointments. So we know that doctors, physicians, the healthcare system itself is disrupting appointments in the province of Alberta. But the story is a little bit more nuanced, a little bit more complicated than just that. And what I wanted to reflect just on a few of these next couple of slides is the fact that hesitancy from the perspective of patients and pre-diagnosis patients to interact with the healthcare system remains a concern in Alberta and all across Canada. As we can see, the bottom two rows on the slide in front of us personally chose to cancel or postpone an in-person appointment with a doctor and avoided booking an appointment with a doctor, even though one was needed, still rests at about 9%, 7%. In the case of pre-diagnosis patients, those figures, as I alluded to earlier, are significantly higher, 16%. 32% of pre-diagnosis patients surveyed in Alberta said they avoided booking an appointment with a doctor, even though they thought that one was needed. And I think that's very emblematic of what I have been characterizing as a crisis of confidence in Canada right now, as far as patients and pre-diagnosis patients interacting with the healthcare system. And here we see another visualization. I hope you're noticing the trend by now, which is to say that we have the Canadian data first I have imposed up on the screen. And over the course of the pandemic, from the first to the second wave, we can see that across Canada, the majority of the lines are showing a negative trend, with the one exception being doctors rescheduling in-person appointments as virtual appointments. Now I'll overlay the Alberta data. It'll get a little bit complicated, and then we'll clean it up again. So here's the Alberta data layered on top. Similarly to a couple of slides ago, we can see reasonably clean patterns. It fits pretty well, but you'll likely notice one color that just seems a little bit out of whack. And that, of course, would be doctors rescheduling in-person appointments as virtual appointments. Now, as I mentioned a couple of slides ago, Alberta cancer patients are still interacting more in person than the average Canadian cancer patient. But depending on how this trend continues over the course of the pandemic, that may or may not be the case. We've seen a particular increase in the percentage of patients who have reported that their doctor has rescheduled an in-person appointment as a virtual appointment from the first to the second wave. The Canadian average was an increase of about 11%. Alberta was closer to 60%, still below the absolute figure of the Canadian average, but it's on a very sharp upward trend, and something that I think is worth keeping an eye on as we continue to progress through the pandemic. Finally, to emphasize my previous comment about hesitancy when accessing the healthcare system, I think this particular slide is very emblematic of that point. And that's the fact that in Alberta, of the patients that we surveyed, 36% said they personally chose to cancel, postpone, or avoid a healthcare service. And we can see on the slide, I've listed 5 of those statements that Alberta cancer patients would have said yes to. So that includes saying that they personally chose to cancel or postpone an in-person appointment. They avoided booking an appointment. They avoided going to the emergency room. They personally chose to cancel or postpone a lab test, even canceling visiting a hospital for cancer care altogether. I hope this can really emphasize the fact that though we have seen a reduction in hesitancy, fortunately, between the first and the second wave, there are 2 issues here that are very significant. The first is the fact that the healthcare system, doctors, are putting off, they're canceling, postponing appointments. But there is also a crisis of confidence across the country, and it's reflected in Alberta as well, as cancer patients and pre-diagnosis patients, for that matter, are concerned that they may be putting themselves at excessive risk interacting with the healthcare system. And as such, we can see that just over a third of Alberta cancer patients personally chose to cancel, postpone, or avoid a healthcare service. What likely will come as no surprise is why. Of course, we asked specifically, what was it that motivated avoiding booking that appointment or putting off that healthcare service? And you'll notice some comments like maybe doctors were hard to get a hold of, appointments became online, maybe that wasn't preferable, and maybe some of those comments would be reflected in your own experiences and some of your thoughts. But what we can see fairly clearly is that the number one reason, the number one impediment to cancer patients and pre-diagnosis patients booking an appointment are COVID-19 concerns and too many COVID-19 cases. Finally, I'll wrap up my presentation here by talking a little bit about the satisfaction with quality of care surveys that we did across Canada. And particularly what I have on this slide is our Alberta data. We found that 55% of Alberta cancer patients said that they were very satisfied with the quality of care they received over the course of the pandemic. Less so, however, for pre-diagnosis patients, with only about half of that, 26%, saying that they were very satisfied with the care that they received. Naturally, many of you might be asking, well, how does that fit into the larger context across Canada? Well, it's not a great story, and that is to say that cancer patients in Alberta were significantly less satisfied with their healthcare services, and so too pre-diagnosis patients. And I'll particularly mention that cancer patients in Alberta, saying that 55% were very satisfied, was actually the second worst satisfaction rating across Canada, only beating out Quebec cancer patients by 1 percentage point. I want to also try and give a little bit of insight into what motivated some of those responses. So as we can see here again on this slide, I've put up the percentage of Alberta cancer patients who referenced that they were very satisfied, somewhat satisfied, or not satisfied with the quality of care that they received over the pandemic. And in the upper right-hand corner, in that box, we have reasons for being very satisfied. Likely these won't come as a surprise to anyone. Being able to be treated, having surgery, getting tests, having good confidence in healthcare professionals. But importantly, the fact that all appointments were kept. These are key features of those patients who said that they were very satisfied with the care that they received. Inversely, looking at the bottom right-hand corner, we can see those who said that they were not satisfied at all with the care that they received over the course of the pandemic. And frankly, it's essentially a mirror of those that were very satisfied. So we heard comments about how there were delays in getting care. Care was being put off, care was being postponed. Doctors were not available, appointments were canceled. And this is a really important one that I feel like whether you are undergoing a treatment for cancer or just trying to get an appointment with your doctor, status of appointments being on again, off again, your treatments being unknown, your timeframes being thrown out of whack, puts an enormous mental and emotional burden on cancer patients, and quite clearly was a driver of those who were unsatisfied with the care that they received. I'll also feature the satisfaction with quality of care for pre-diagnosis patients across Alberta, and many of the points I'll make on this slide are going to be very similar to the ones I made on the last. So when we look in the upper right-hand corner, reasons for being very satisfied with quality of care, things like good service, good support, obviously very important, and those sorts of things drove satisfaction among pre-diagnosis patients. Good confidence. Again, confidence was a very important feature that came up in being satisfied, in fact, very satisfied with the care that Albertan pre-diagnosis patients and patients received. Finally, doctors being accessible and being available was a very important feature. In the bottom right-hand corner, again, virtually a mirror image, which is to say that delays in getting care was a major driver of those who were somewhat unsatisfied or not satisfied at all with the care that they received. And that's the largest chunk of pre-diagnosis patients in Alberta, at 32% saying that they were somewhat unsatisfied or not satisfied at all. Those responses were also motivated by the status of treatments and appointments being unknown, caught in limbo, as well as doctor availability not being stellar, and the fact that appointments were put off, they were canceled. These sorts of things drove dissatisfaction when it came to pre-diagnosis patients, and as I said, is very similar to the comments that we received from cancer patients. So finally, just to sum up a few of my final thoughts in doing this deep dive into the Alberta data set and providing a comparison with the experience of Alberta cancer patients, caregivers, and pre-diagnosis patients with that of the national average from our survey. First thing that stood out to me, first and foremost, as I mentioned, Alberta cancer patients are particularly concerned about their ability to access emergency room care. And we noticed this trend both in the first and second wave of the pandemic, and it is picking up steam. They stand out as a province that over the course of the pandemic have become particularly more concerned about emergency room care access. Second thing I want to highlight is the fact that Albertan patients continue to interact with their healthcare teams in person more often than the average Canadian. We spoke about that earlier, though doctors are canceling in-person appointments in favor of virtual appointments more often than is the average across Canada. So we'll have to see whether or not Albertan cancer patients remain interacting with their healthcare teams more in person, because we're seeing this uptick in rescheduling in favor of virtual appointments. Third is the fact that though, as I mentioned, 55% of Albertan patients reported being very satisfied with the quality of cancer care they received over the course of the pandemic, that's the second lowest satisfaction rate nationally. As I mentioned earlier, only above Quebec by a single percentage point. And finally, I always take an opportunity to make this statement in my presentations to try to add an additional layer of context in terms of the challenges that are facing the cancer community at this time, and to give a better understanding of their frame of mind. Patients and caregivers in Alberta and across Canada continued to express a greater fear of getting COVID-19 than of their cancer coming back or getting worse. And this is exactly in line with the comments that I made earlier about there being a crisis in confidence, not only in Alberta, but across Canada. The fact that more than a third of cancer patients elected to put off a healthcare service of some kind is emblematic of the fact that they are very concerned about COVID-19. And I think if I can just offer a final thought on that point, this is why it's so important, we feel, that we advocate that cancer patients be prioritized not only for the first dose of the COVID-19 vaccine, but for the second dose of the vaccine, to ensure that they are being given equitable protection and to reinstill a degree of confidence within cancer patients to interact once again with the healthcare system that they so rely on. I'll wrap up my presentation there. Thank you all so very much for your attention today. I hope it was informative, and I will turn it over to Layla now. I am more than happy to try and answer your questions. So again, thank you so very much for your attention.
Great. Thanks so much, Conrad, for the presentation. And thank you so much, Tim, for joining us today and for sharing your perspectives with us. So we have a few questions in the chat, which we should hopefully be able to take just before we end. So the first question is, when it came to your meetings with MLAs, did the nature of your meetings change depending on whether you were speaking with government or opposition?
I would say to a certain extent, but not tremendously. The presentation that we brought before MLAs in Alberta was identical, with the exception of our evolving concerns, as we mentioned. And I did my best to bring in the latest research, the latest articles to really exemplify the fact that this is an urgent concern. But our conversations, the points that we were making, the attention that we were drawing to the major issues, particularly around vaccination, did not change whatsoever. I think as Tim alluded to in his remarks, we maintained a diplomatic and professional tone during all of our meetings. It's so important that we maintain good relationships with representatives, although we absolutely understand the importance of applying pressure and trying to provide them with as much information as we can. I think one tone that's important to take away from our meetings is that they were heavily education-based. The meetings surrounded our COVID-19 and cancer care survey, which I had an opportunity to share with you all today, but also to try and bring to the forefront the emerging research, especially around COVID-19 vaccinations and the cancer care community. We presented all of those facts and figures very diplomatically and with a tremendous amount of professionalism, making sure that representatives were aware of our concerns, and we firmly expressed them.
Tim, did you have anything you wanted to add on that point?
I totally agree with Conrad in that. I will say there were a couple UCP meetings. Everybody was responsive, but one in particular was quite responsive, and I believe that has helped move things forward. Do I know that for sure? No, but it felt that way.
Thank you. Next question. If you were to conduct another survey based on the third wave, are there any other questions that you would want to ask?
Yes. Oh, yes. And I'm going to try to contain my smile so I can respond to this question, because this is something that I'm very passionate about. I was brought onto the CCSN team about 9 or so months ago, which is really when the first survey was beginning to be crafted and fielded. And I've been part of the organization now for both surveys, and I'm incredibly passionate about better understanding the experiences of cancer patients across Canada through these survey responses and through the data analysis that we can then bring to representatives. A particular area that I want to focus on is vaccinations. So we've asked a lot of questions in our previous surveys, as we mentioned, the physical, mental implications of appointment delays, and I want to continue those dialogues. I want to be able to track and identify to representatives how those trends have evolved over time. But I would love to understand how many cancer patients and in which provinces have received their first dose of the COVID-19 vaccine. How many have received the second dose of the COVID-19 vaccine? And then from there, I would love to look for trends. So are we noticing that certain provinces perhaps are doing a better job of getting COVID-19 vaccines out to cancer patients, both the first and second dose? Are we noticing any difference when it comes to rural versus urban Canadians and their access to vaccines? There's so much analysis we can do focusing in on how those vaccines are making it out to the cancer community. And it's those questions and more, specifically targeting the issue of vaccination of cancer patients, that I would love to focus on.
Great. And so we're just about out of time, so I think we'll end with one more question. So based on the information that we gathered from patients in this survey, are there any specific takeaways that you think can properly inform any cancer recovery plans that we have going forward?
Certainly. I think a major takeaway from our survey was the fact that there is not only a need for investment in healthcare services, specifically surgeries, testing, diagnostics, and so forth, but our survey also reflects an enormous mental and emotional toll that has been impacted on the cancer community. And I think as far as a cancer recovery plan goes, it absolutely needs to revolve around physical health, investing in physical health solutions. But we also need to invest in mental health solutions for the cancer community, as clearly based on our evidence, and I can elaborate a little bit further, not only are there concerns about receiving adequate cancer care, receiving emergency room care, but we also asked more broadly, how has the COVID-19 pandemic, and as an extension, how have the delays in your treatments and appointments impacted your day-to-day life? And we've had an overwhelming response in our survey that patients, caregivers, pre-diagnosis patients have had difficulty sleeping. Their diets have been impacted. Their relationships with their spouse, there's been tension. So we know that beyond just the physical health implications, there are mental health implications to this pandemic, and it's no difference for Canadians, and particularly hard hit is the cancer community who have had their appointments absolutely disrupted as a result of COVID-19. We need to address those physical health implications and also the mental health implications.
And Tim, are there any areas in cancer care in particular that you would like to see better addressed going forward?
I think Conrad summed up that very nicely. With appointments being canceled, things that happen in that world for cancer patients, there's a mental side to this as well that is really, I think, impacting many cancer patients. In Alberta, went for treatment last week, had to have a COVID test because there was an outbreak. I'm just saying there's so many things that are happening, and there's nobody's being blamed for that. It's just that that's the world that we're all living in, that I believe what Conrad just indicated is pretty key.
So with that, I think we'll wrap things up. If you have any specific questions for Conrad, I believe he shared his contact information, so you can reach him at publicpolicy@survivornet.ca if you have any follow-up questions, and I'll be sure to include that email address for you in the follow-up email to everybody who registered for today. So thank you again, everybody, for joining us, and thank you, Tim, especially for taking the time to be here today. Have a great day, everybody. We'll see you next week.
Thanks so much, everyone.